Well, more and more Americans are going under the knife to achieve the perfect look, but it's not just women who are getting a nip and a tuck. More men are seeking out plastic surgery too. Let's talk about this and more in today's Medical Hot Topics. On the panel today, plastic surgeon Dr. Rolando Morales, neurosurgeon Dr. Sebastian Herrera, and periodontist Dr. Ralph Hanna. Good morning. I'm looking for signs that y'all may have done something. I'm looking for signs. No. Okay, so yeah, typically with plastic surgery, it seems like more and more women were going in, but are you seeing an increase in men coming in too?
Absolutely, absolutely. It's just increasing every year. It's just, people's, social media, just, being in front of more people is becoming more dominant in guys.
Yeah.
And they want to look a little bit better and feel better about themselves.
I think it's because Mama was coming home looking better, and they were like, I got to keep up.
Right.
Right?
That's right.
Yeah. And you as a plastic surgeon, there's all kinds of things that men will get. I mean, sometimes we say that men with gray hair and the wrinkles look just fine because, it's a handsome, rugged look.
Right.
But even other parts of the body, like sometimes you'll see guys want pecs and things, right?
It's just a spectrum, but definitely I think the most common thing right now is guys are doing more non-surgical stuff. Okay. So like, facial treatments like Botox and fillers and skincare is becoming more prevalent. Non-surgical procedures like hair transplantation, that's just exploding right now. It's just an amazing procedure.
Huh, all right. Yeah, no wonder some of my beauty products are disappearing at home. Okay. This one right here is, and I can relate to this, deaths from falls among older Americans on the rise. My mom fell and broke her arm, and oftentimes we'll see that people will fall, and then that's kind of the downward spiral. And then the other concern, I know when my mom broke her arm, the other concern was, can she make it through the surgery? That's one, but can she make it through the anesthesia was another.
Correct, and I think it's the rising age and having longer life expectancy, so that's why the statistics are showing more, because more people are living longer. So
yeah,
this has to do also with when they fall, not only do they break long bones, but can they hurt their heads, right? So as we get older, people need more anticoagulation for, say, AFib and heart conditions, and a fall can lead to an injury in the head. With anticoagulation, the combination of those two things can lead to a brain bleed.
Yeah.
We do see a lot of patients that fall, hit their heads, and end up having subdural hematomas. They don't show up right away. Sometimes they show up 2 weeks later. Patients get confused. They have weakness. They have trouble talking. And at that point, the family brings them over, and that's when we find it. But it's always good to remember that if somebody is on anticoagulation and they fall, they should look for an evaluation.
Yeah, or if they fall at all, because I think the first thing they say, do you feel like anything's broken? If nothing's broken, then we forget about it. But you're right, if they fall at all, you know that they hit their head, maybe just rather be safe than sorry and bring them in. Correct. All right, this next topic, brush your teeth to postpone Alzheimer's. We certainly know that, Dr. Hanna, when we are brushing our teeth or dealing with our mouth, there's all types of bacteria in there. And we've seen that related to heart disease, so now related to Alzheimer's?
yeah, for tens of years, we knew that the body is connected to the mouth, and it's just one circulation that the bacteria travel in the body. But this is the first time that we have DNA evidence of the bacteria that causes gum disease, the main bacteria that causes it, in the brain of Alzheimer patients. And we never knew how Alzheimer develops for sure, and how it is who's at risk and all that, and we know there is so many factors, but to find bacteria, and that study showed that the people that had the bacteria got worse faster too. So it is a very strong link, and actually they are now thinking seriously about how to develop vaccines against this bacteria, not just for gum disease, but then for other. Like we know there is heart disease, that same bacteria was found in clots around the heart. So it is a very destructive bacteria.
Yeah, all right, so brush your teeth like 40 times a day, right? Okay, in the meantime, until there's a vaccine. Okay, vitamin D, this is one of those things that we are so deficient in. I think every time someone goes in for their full physical and gets blood work, they're told you're very, very low in vitamin D. But they're saying now that vitamin D may prolong life in people with cancer. I think it could prolong life for all of us, but in particular people with cancer.
I think that's just a fantastic finding. I just read about that a couple weeks ago. Vitamin D obviously is very common vitamin that we require, and just supplementation is pretty straightforward. I would definitely recommend it.
Yeah, yeah, especially knowing where you sit, because if you're
Right.
super low and we need it, then obviously the body's fighting for something.
Absolutely.
Yeah.
We do have the advantage of living in Houston. Vitamin D is made by getting exposure to sun. If you take it and you are out in the sun, then we are somewhat protected. then.
And that's where we get kind of confused though, because they're like, no, don't get in the sun. Yeah, you got to get in the sun. Don't get in the sun. Yeah, you got to get in the sun. So the thing is to make sure you have moderate exposure, or just make sure you just have a little bit of exposure. That should be enough for us to produce that vitamin D.
Correct.
Monday, Wednesday, Friday is
Yeah,
sundays.
right. Yeah, at 5 p.m.
And
as the sun
Tuesday
is
and
setting.
Thursday.
And the whole bit. Yeah, don't get too much. Okay, I was a Norwegian woman, and then I went out and I just laid out for a moment, and this is what happened. Okay, actually, I spray tan. I'm sharing some personal stuff with you right now. I spray tan, and it was hysterical because a woman came in after me, and she's like, "What do you do?" I said, "No, this is the spray tan. Be careful. Don't get the highest level because this is what can happen." All right. Well, it's just like that brown bronze look.